here today to discuss the different sorts of hip replacement techniques. Now, you've probably all heard about anterior hip replacement, and probably not a lot about the older style hip replacement, which is mainly the sort of posterior hip replacement. Now, the reason we do the replacement in the first place, is to get rid of your pain. That's all that's about. How the surgeon actually gains access to the joint is his own personal preference. The traditional way has been to come in through the back of the hip, to make an incision, to release some of the muscles which control the hip. We call them the short external rotators, and then to go into the hip. This is a time-honoured and proven technique, and it's very hard to criticise this technique. The other approach is the so-called anterior approach, which means that you come through the front of the hip rather than through the back. There are advantages, in my opinion, to going through the front, and the main advantages are that by going through the front, we go between muscles, there's no cutting of muscles, and we are directly onto the front of the hip. This particular technique usually makes a hip that's more stable, and so afterwards we let people who've had that operation lie on their side straight away. We allow them pretty much to occupy any position they like, except for pushing the hip out through the front. The rate of dislocation, that is when the hip pops out of place, is very low in both approaches. It's probably a little bit lower in the anterior approach. Also, people who have both approaches don't tend to have a limp after surgery, and you'll be pleased with how much better you are virtually straight away. So what's it like to have a hip replacement? Well, we would bring you into hospital usually on the same day, and having brought you in, and you will have had blood tests and urine tests before, and certain swabs to make sure you don't have staph on your skin, we will then admit you to the hospital and we'll take you straight to the operating room. Now, I will also give you some special detergent, which is an antiseptic agent. What you do is you wash your whole body with this stuff, usually 2 nights before the surgery and on the night. And the idea is to kill the bugs which are resident on your skin. I mean, everybody has bugs on their skin, it's quite normal. So we do the operation, generally speaking under general anaesthetic, and you wake up in the recovery room, and usually there's not very much discomfort at all. The operation itself is not particularly painful, and often people will say that the pain that they had before the surgery, which can be really quite debilitating, is gone as soon as the surgery is done. So you're left with a little bit of what we would call surgical pain. Now, we will manage this very effectively for you with some tablets, and we'll get you out of bed on the same day as you have your surgery. You will be probably allowed to put your full weight on the hip, but if we think that we might use an uncemented hip, that is where we will just put the prosthesis into the bone and not cement it, then we might ask you to use crutches for 2 or 3 weeks. Either way, you get up and walk on the day of your surgery. Now, you'll generally speaking be discharged quite quickly. With the anterior approach, I find people go home usually within 1 to 2 days. The posterior approach may be another couple of days extra. So why do I use one approach and not the other? Well, the anterior approach is very well suited to people who are not overweight, and particularly people who are not very short and very muscular. It's more difficult in the very short and muscular people. Now, if you're very overweight for whatever reason, we might choose the posterior approach, and we might also find that that gives us an easier access. In general terms, people will be discharged from the hospital 1 to 3 days after their surgery. You don't normally need to go to rehabilitation, and usually there's very little physiotherapy necessary. Once you regain your confidence, which is pretty quick, you will find that you'll be able to discard your crutches normally about 2 weeks after your surgery, which is when I will see you in the office. And at that time, my nurse and I will check your wound, take the dressings off, and we'll find usually that the stitches are removed, and we'll let you start some water-based therapy about a week later. Of all the things that you can do to recover, water-based therapy is the best. And I'd advise you to consider looking at a local pool and booking yourself in.